Pacho, life will need time.
Well, you should be worried if you are not going to the right place because of the possible complications here. But I don't think the concerns number. We should attend the
so you who's a man for Ayabina, a man for exercise on now, we can defend there. I see Unis Kenton and Uncle Yabino. Doc, is it for the rich? Is it the expensive?
Yet, in fact, for about number one is liposuction.
Okay.
And then liposuction and BBL.
Okay. And a one.
And a one.
It's been a long time since I'm a doctor. Na America Canino, a lot of people can't a body some. A lot of questions are a man for Ebusa. Now Refi says I'm Felix. Bene lawyer Abrakwa. At Nasi Edin Komoda, our church and all remain no. Let me come back now, minute lawyer any in hobby because in some year for Busa say Buha Busada, a bones on Busa that na Minjim Chim, when I'm a dear. No almost all Busa questions no omu enya emu eye enchemu ye. It's a Baba aye doctor the fee. Dr. Kwame aye Abrakwa the fee yebidi inkombrebe na me no nyame adom ama doc so enya aye award for cry ewa ha busa en etwago aesthetics and cosmetic services awards you say the man individuals mabo homodin no doctor enenya during the 8th edition of the Ghana Industry CEO Awards. Doctor ena order aye Total Cosmetic Surgery Solution. Doctor, congratulations.
Thank you. That's it.
Then I'm here so this award we Edema.
Say Ansan will be over Abasobono.
Yeah.
Na ya so we Jumashe.
Yeah.
Inti omo echo online and omo choose one ma omo ye sadi and a man for ye voting near the nature say mena sani mani na Mitoso number 1. And last year, or Mammy award that is for 2025. Minya sa award.
Now, any person almost shortlisted or more, Emma doc, a winner's award.
Honestly, minty minchre.
Okay.
Minty minchre. They only told me that this is a number. If for me, for people to vote for me, this is a number they can vote. They can use to do the voting. Okay.
So let me read the citation, Emma, proudly presented to Dr. Abrakwa Yanchira,
yes.
Chief Executive Officer, Total Cosmetic Surgery Solution, Aesthetics and Cosmetic Services. You have redefined the role of the modern CEO beyond profit to purpose. Your transformative, sustainable corporate success and tangible national development are two sides of one coin. It's a doc about modern power. Seba eye adwuma oye ho a enya afi na any doc be din come about ne oye no oye ho doc eboa ema mo hefe osisi ema se eba lipo se bia body baby no ohwe na woni nje ho na pese doc esi eboa wa na waboa na oye two apostles no two apostles na wachi no na oyem so doc ebetimi yama doc nsem rebe aba in the system. I'm sure say who say marry na adjatum ohwa marry eje lipo and say tummy tag na etum no for our society and I say because a lot of people still speak against these things because they choko cross aton eto e the measure yastic.
Me da se pa ansa na ebe koye nim no I was say me den na se kese ma wonu a omutie yen ene wona waba me nchen se menye omo ho adwuma enye won man kasa award in Kemba nti obi biara waba me ho e free say started say adwuma be say 2008.
Okay.
And me shall say
next 2 years be 20 years.
Yes.
To 18 years now.
Exactly. Nti me da omo nyina ase na enipa bebre aba system no mo a problems na dey koso nti mo remfi baby a omo fi omo hunu me no into omo ni hon komo enche omo namfo nom ene ade so that they can also come and benefit senior omo nya a problem bia Now, Nancy, and never be brave a coso. Ah, a binomo, and your problems near the fa Nancy Croby the video be sending me, just will be a wakwakoye procedure. Na said you say canono, just a untimi yanoshi or dafako, or da kemukrano, untimi entinemu, or nefru ebutukanomu, obedi dear crown or daho any feeding no. Am say we exaggeration. If say Mr. Obama obi Obama chen bia ebedi ho dance here. Oba na say procedure ni we a anopa bobo be 6 no. Na ye share catheter senia because of procedure no anesthesia de be ma on nti. Wontumi one kasa wontumi sore nkodwen so just say ade a chance. Nti catheter ni free for pay. E wo say one kasa onante eko washroom. Ye nsevo bibie say o ube dwen so ewo mpem anan wankasa na o wa be nante aye bibia edidi enso so ubetimi atenase na wankasa wadidi se makonwan sei ubetimi atena akonwan se o akonwan bi wo se a ubetimi atena akonwan so sei na oto no ense osre esi so na se oto no wa akire ewo ye ne saa no a pressure bia na oto no so enti ubetimi aye ne ope ubetimi atenase edidi ana se ye ma bad pillow would be to akonya so into the to akonya na se na kese wo sre na esi so na wachi e de ahange wo ye ne sa wonya problem bia wo wi a wetimi de afo flight ana se wakọ baby of free bia wetimi de akọ intino ensem bebre omo ka no so enye no kre na especially
about
after
say amount pillow out how long are you going to sit on a pillow
to say
maybe you're starting na
oh say me fan say obe so didi a otena se na odidi wi a no asan akoda ho normally no say oye liposuction na say ye the fat ni bi eye o to fine ma wa eno no wontimi entrance se na me no etiwe
for how long
you need about 6 to 8 weeks
okay
and san wait me attrance normally
okay
but we have an 8 a bit me abo am wait me attrance no ne bad pillow na make am
okay
into the to akonwa no so a na ekwan kakra abeda wachi senia wo sre eni so na otenase a obetimi agigi adem so that your back is resting na wo sre no nko a eni sa pillow no so no ma ye more comfortable person di obetimi didi enye no krese agise wada ho anyway no enye right enye right and after care no so price no more can wo or they saying Instagram ni ade no na procedure na nkasa ne boy saying
people are mentioning 100,000
100,000 no it's not procedure na nkasa nkra e do say na after care akwa 100,000 you know and yema na motin wo online social media and be just exaggeration you know mon for margin nkoso wo hia procedure na you come ye be hwe bibia amo kama
na me ni obi edin ko or different country no say a person fly to another country to do it now or dwen ho ana me koya na say bia omuja bibi tum yema be na masa fly back to the place and do it. Is it advisable say you fly all the way to some if that's what Ghana say doc has now over fly to a different country to go and do it
over quite told you now some of the country we or one over kidney back on Emma yes if you go on social media you find you hear about it but me more country crop but say adepa wo fear senia ye president awanya bebe ko Professor Tamil adi wo fear oye so if say oh fear because nipan be brom say oh say obe recently people came here lady be say no US na ohun na down for no na chese odi na chi buy and also on na buy because oni so na down for no betimi ama no support fine into no buy and there are many others who prefer coming some be fee if you say obe fee dia you get all the support family support 7% obusun afon so be hu a we have a place we can arrange for you to recover and cost you so much and you know person oba e kwan da obra but so be call baby na obenya problem ni ade there enye
doc a kwan da obra who are the people are qualified to undergo a surgery
well so far maybe the maximum age my year will be annually 68.
68.
68.
Yes.
I did it last year. Or no, Baba year or US or Baba year liposuction.
Lipo ni
I say be fat in free.
Okay.
Yam anyway chin on film near them. But any person of adult age, a free 18 near the but a bit more also so maybe they are young, but one more is so obese. And also so no, it's possible to do liposuction for them. And I feel so no baby no a war indication. So I can say over liposuction. A jina teacher no omo da. And I also me liposuction because
obi onwo da.
That's yes, it's the best time to do liposuction. But when you na ama we fru no war no emu abai. On say omo me exercise we say muscles no omo fu so no gina honom.
Yeah.
Aha. E kwan ketu e bi na da muscles ne ntem. Na say unyinsan a ye fru ne kese a na amasa akwan emu abai. Indi say nipa no wo wie anase wo na so aka so we fru a kese nti o peso ba be lipo a. Wo ya e fru no enkofom. It is will be a order because sa gap na da muscles ni me no entem no. What you think said then still the inner contents no push against it e man stretch it. Just say repair and we repair that in tummy tuck. Into be our the best ni say obey tummy tuck.
Near lipo.
Near lipo. Unless obani exam you say oh the gap is very small and it will be okay for you. And they say, me no be a UK me na kasa me say, oh, I will be as a 3 as a 4. And I make a chance so. Never buano pie tummy tuck. Inti, I was still out there. Like inti, me say, well, many our cancer open me yamao.
Okay. And you know, obwa send obinti as no difference between lipo ni tummy tuck name.
Lipo no in say liposuction means removing just fat. To shape your body. And when we come to tummy tuck, it's a surgical procedure that repair the gap between the pec muscles. By medical term, you can say the line there, we call it white line or linear alba, white line, and it becomes wider. If you do correct me, a wide base 4 inches and 6 inches. I would wait to say gap in there. One more day, I say. Or more from no, I white. And no sano, the best thing is to do the tummy tuck first. And our advice will be our no. And our advice again say, over sure those as chinchina on your liposuction tummy tuck. Oh yeah, the problems are enormous, especially when it comes to wound healing. Inti a bit more or catch the mom said, no, we just want it like that. But it's not the best because the entire no. So liposuction, it affects your blood supply to the tissues. And then when you do the tummy tuck, so we raise a flap where peja skin when free muscles no so. Where it reduce the blood supply further into my healing no. A bit challenge. So the best thing is obeying in stages. We be kind tummy tuck. Na H3 no. Liposuction am come.
Okay.
And no, you get a flat tummy like you're a virgin.
So obi on with that enye lipo.
Yes.
Obi on with the enye tummy tuck. Now obi on with that lipo no. People keep asking, will the person be able to give birth because your tummy becomes very flat?
Even say oh tummy tuck crown out in your.
So
yes. In the liposuction there, you see, when you get pregnant, the uterus get bigger and bigger, and the muscles will stretch. So your tummy tucker, the stretch is not from the but it's the sides. Intinina evekese admit enlarging uterus. So any of the procedures is compatible with childbearing.
I won't face any challenges because people do raise that concern.
You don't feel any challenge. So me catch you say, my clients maybe aye akwa lady be say me kai say ono achebe somewhere 2016 and around that time yeah tummy tuck emano afi one day me wa na of friends so surprise mommy what is the surprise was you wow na emra that time na me ye adwuma wo baby am ye adwuma na gynecologist bebre wo honom into a course en ko and terminate pregnancy no and doctor say no you can give birth and then omunye na oye procedure anyway na funu sa conform to send ne ayin dana so it is not something oya untumi enwa na bibisa.
Okay, among for fear say the risk involved in the lipo tummy tuck and omobeye omonofono omotono very high.
Good. This is a nice question. Should I say every surgical procedure has risk. Because I say na me a young doctor. I say master me a medical officer by 2 years after medical school. And na you push to me call outstation. I'm going to more problems pa. Into me director I say, oh, this is the problem I've encountered. Or my instruments, so that simple hernia I can help them. I can't share me say, I should refer to the regional hospital. I should refer to the regional hospital at the intra. Or see when professor why circumcision now the child died because of bleeding. I felt that if a child is young, especially you don't do circumcision before 8th day of birth. If your Bible man, Yankubo country Abraham say, "Akodane 8th day no betimi aye circumcision." That's the time blood meet me clot.
Yeah.
And here on kodan so and as mpanyimfo kra on blood intimi clot. Yes, intimi clot. So na was a professor na e check say akodane or bleeding problem. Wanye ene sade nko bae. So because of that, we do a very rigorous lab investigation, including your blood clotting. Either say, yes, surgery na ube bleeding, you want to control bleeding, and now say, or condition be a very amount of blood na clot, so be blood clot in your legs or whatever. So you need to investigate the person to know the problems they are having. And there are times also, especially with the saying, blood clotting in the legs now. You may not be able to identify, so you must provide a means of preventing them. So we have a pump. You have shower 9, or you have shower 9. You have massage 9 throughout the procedure, and until the next morning, you be here as a washroom. And you also add a tail stocking, and also natural. No? You control blood flow. And if it's your blood thinness, you have the injection heparin. The Bemau, copy say, one can say, very actively. Even if that one, if it happens, you detect it early, and there are signs for you to detect it early. If we didn't find it for surgery, then we give you treatment. And you know, yes, there are challenges, but we try to prevent them, and when they occur, we do our best to give you the best of treatment.
When it comes to lipone tummy tuck, in toes ne in one of my ne banku by here fufu.
Yes.
Patro lipo ne tummy tuck, ne beti banku fufu ne by here no.
Oh, say, me and me too say. In person me kesi be in person me fu be kesi. And at least me who say oh me na mama. Oh, ni say me dini be pray. And I face and you so no me mad and some aduane so. So if you have that, if you have good appetite, you hear say obekwa ko hu or the saying dietitian.
Okay.
Yeah, procedure and we are going dietitian. No amount portion also di ebe fit say adwuma we ye. Sene wondi mbroso ema wodi di broso a na obekwa akwa kese no. Until once you are able to control your appetite and your diet, you will not gain weight.
Okay. How many times can we do it in our lifetime?
As much as you want.
Really?
Yes.
Kwano be our first one. or yeah, no, I can mention a name. Some woman actress. Onaga Saba won't tell her I first one, as I second one, and she feels that the second one, I might feel okay.
Yeah, most of the time, no. We are first and no by no. Yana fat and nose. In TV, up as a year or hip and or two mouth. Then, and I'm saying, and also into unya shape now open. Secondly, Senia, ni intrama ya kasiana or fat and buy no. You still continue doing it at the day. So if you have a uncontrolled appetite, Vesamba. Until maybe after 1 year, you can do it again. And especially, binum or horn, can say, oh, the 9 to is into a per se, or man a yakasi. People like that, when 9 to the end, say you can't put in so much of the fat. Craving a bit in there because a cobroswa, the body there will not be able to contain it. You you may lose it. So I was saying, kakra, into maybe first stage, November, after maybe 8 months and 1 year, no, the second time it will improve and look very good.
Look, my contact na Yantua. All
right. Say, open say, once I come here, we call Instagram.
Okay.
Instagram, lowercase, DR, as in doctor, DR. Now dash, what the dash about underscore. Now the curves, CURVES, Dr. Curves. Yeah. DR underscore curves. Telephones also, mostly WhatsApp, 055 399 8989.
Okay.
055 399 8989.
But Dr. Rakwa, Dr. Curves, and a din komo na OBB and Noma and this about a body enhancement. Say say or two, say or food in a dog.
I say who in a car.
Dog has somewhere there.
So also hotchi.
Also hotchi. Nina way.
Nina. If you so on as your lips, you are not a susu. A yai usia coin. And it's all bad.
And what causes that? Is it natural or because
natural?
But can different sizes enter the cause of that?
Oh no. On say so here nipa krana it be a sling. It be a kese. In the sun body parts no so etimi eye. Sebe here inu for no krana obi ho no mo a wa several times inu for us obi a virgin. But obi ho ngo dance inu for no atie good so obi a wa be 12. Enti obi a ne senia ne body construction is it here.
Dog, what do you have about Obuha? I do a cost issue pa. Question. Obuha, I say, meaning the size of Memadeno. But I said, I'm call Remuno. I said, it won't be no what for baby. Communicate me the Roma, me the way. I said, I'm calling Nico Remuno na oh Bahano. I said, I'm too quiet no. Offer baby, and will be more than the usual size.
Yeah, it can happen. It can happen. It can happen because on say Obama no or him said there and structure city.
Okay.
Into oko baby. Nese okoye it should not be just once. So this one should be several times.
Okay.
And then that one you will see a much wider spacing than ABA when nipano kwao.
Okay.
If you have that problem, you don't have problem. Okay. To make me tighter for you.
Okay, so you can make it tighter. And when you go to school, I think when we're learning genital, you say, remember you can't go beyond that. Is that true?
Oh, maintain no be that.
So
no, say I was say you the man, you know, say if you are too long.
And then the woman is,
also on how you manage the situation.
Okay. So in that case, where the woman is smaller, no, can we also work on the woman's property for it to fit the man's own?
No, say we know length. We are talking of length.
Yeah.
Length in idea is you cannot do anything about it. And I already know. So if it is tight enough for the woman as well, the only thing say the man shouldn't penetrate very deep in order to punish the partner.
So, Obabi person or work your house and so what's your bar? Or person or work your.
Oh, definitely. Yes, she can come.
So, I was say to make you feel comfortable because right now, the man is saying the mom will feel comfortable, and a lot of people are doing it. Doc, should we worry about it as a society if most ladies are doing the lipo or should we be worried?
I don't think so. Well, you should be worried if you are not going to the right place because of the possible complications there. But I don't think the concerns nabano. But say oko baby when say when you come out, you don't carry any problem. Then you don't need to worry. Now society is changing. Society is changing. And you know, it is very difficult to say now, these things we are talking of is a very big concern for the women. If you say, my wife, you worry, me share the picture, she was very, very, very young. Very young, in her 20s. Na, I want ama ni body shape ni nyina atiego. Wohwe na full cry, I mean, it's you don't decide. Meanwhile, men on cassettes, they go outside and do it. So, if there is a way to make them look more attractive, I mean, to make them feel confident again like they were before. Now, talking about this, a man who acquire on fast today, they are wearing a lot of things. Say, a man try a say, and I say, a bema corset, a bema a funa a kitwani and it's a lot of challenge for them. They suffer. They were heat in and you know, if you can have one-stop shop, you go and then you get all this procedure with no possible problems. I think it's good. Rather than say, over how I want to turn near my within a short time, the answer was also copy for. Sebi, when you obey my call, Okostra boy, for example, let's say, Oshe, or more pantina, a fool. I mean, we show a time you who rad him over, I don't know that I mean. You see, it brings a lot of, concerns. Two, some of the women are also having issues with their marriages because of the way their shape look like. So it is not out of the way to come and get yourself back to how you were before.
Okay. Doc, Yansha Aviana Angelina about Dr. Kevso. Take us through the process from the beginning to the end. Okay.
Now, if you are in Ghana, you come to my clinic, or outside in Osua, we can do online interview. I have a series of questions to send you back clinic. So after that, you start outside for them. Now the picture account near who send you sit here. Then we say, oh, this is a procedure that is good for you. How many time crano? Yama your labs in now. Oh, by just one lap and I say, maybe a flight, there's no blood clot in your leg. And Sanya. Now, so you'll be an organ I had there. Oba clinic. Oba clinic, near interview, you examine what we say you are fit. And then after that, you go and do labs. Lab, you better and the last one, your urine. And then we do various blood tests to show the level of your HB, how your blood cells, if they are adequate. Then we have another type of the cells now, a control clotting, and it's a friend platelet. How is that level? If we announce a train say, if you receive a cut, how long your blood will take to clot? Send you over bleeding. Your friend clotting profile. You hear that one also. And now say a tester. Who say who have the tendency to develop blood clot in your legs. And also your friends say D-dimers. quantitative D-dimers. After that, we check for diabetes, we check your kidney function, we check your liver function, we check your thyroid function. In fact, at first I was not doing thyroid function until several years ago. I noticed that some people were having thyroid disease they didn't know. They were walking around. So now it's mandatory for everybody to do thyroid function test.
What is that? Thyroid disease?
I'm an extreme form of influence, like inflammatory immune condition of the thyroid. The body starts destroying itself, like in the thyroid, like we talk thyroiditis. So we make sure you don't have any of this. In fact, the first person, let me say, surgery UK, and it took so many hours for her to recover, to recover from the anesthesia. In the exam, he said, no, he has a problem with the thyroid. He probably said, or thyroiditis. So the investigation is very, very, very important. You make sure say all the organs, in problem, you go through all of them. Now, after you, then we also do Doppler of the leg veins to ensure that there is no clotting in your legs near there. And sana yako surgery. Surgery also so the night before the procedure, your last means about 6 p.m. after the debut. So you come to the theater on empty stomach. And then before that, the anesthetist will also have a chat with you. Or no, so because beside questions, I will say be our problem be say we need asthma, we need respiratory infection, there's no cough near the, so that your body is fit for the procedure. Now on the operating table, before we put you on the table, all your body is clean with antiseptic solution to remove the bacterial load that can cause infection. Then we cover you, and depend on the type of anesthesia. If we are doing epidural, you will sit on the bed, and then the anesthetist will do that procedure for you. Look for epidural, and also a man be brought outside. And if you are at the end, and a man anesthesia, you be chipani near the catheter, a shame, so that we put a medicine, a pain relief, local anesthetic. Yeah, the begum every 2-3 hours. Procedure. And say pain. There are times the place where we are working, the epidural doesn't go there. See, it drew on more. We'll give you something to sedate you so that you don't feel pain, especially the upper abdomen. And it will cheap. Then after that, when we are done, we'll close the small wounds, and answer the major wound. You could close in. It depends. What the fat baby and also now, when we are doing this, we do markings to help us so that baby fat no be brain. We mark that place out, especially side folds. No, you mark it on and or hip. No, so baby deep once you mark it, so that when we finish removing the fat and want to transfer it in those places, it will guide us to put it at the right places. So after that, we close all the small wounds, especially with the liposuction. We have some sort of a glue. Yedibe seal, especially or 200, yedibe seal holes in sending any contact with the outside, and it causes a lot of infection. If you know how to occur, when you're abscess near the. If you do that, you try to prevent all that, especially around the buttock area. Then the next thing is pain relief. Say, won't pain pain. Now, because of the epidural, we leave it there for 48 hours, so that periodically we put the pain relief into it. Apart from that, we also have other pain medications that we give. Every 4 hours, you get a pain relief. Sometimes, in some conventional pain management, they will give you every 8 hours. But we give 3 different pain medications, and it's given 4-hourly interval. So at the end of the day, you get better pain relief by using very little. So, and then after that, you come to the ward. So then I can say a simple liposuction without fat transfer, they are waiting at the wachi. But say a division wachi otoa and the obeda winning. And now say we have a way ubeting at that when chemu kakra, but not on your hip. What do you say?
Yeah.
And I think so it's very, very important. Say the next morning you start walking around. Because if you don't do that and you stay long in bed, you develop blood clots. So it's important, say, next morning, you know, you urine catheter and you start walking around. Because of inadequate fluid balance, no. Oh, sorry, precopa when you be brew. Until obetra butu and panaso kakra. So to me transfer obetra and panaso kakra be a few minutes, so that the blood that will drain into your leg will not deplete the one going to your brain. When you be brew. So when you stay a little and say you sit or you bend on a bed for a while, the body will adjust itself so that your brain doesn't get deficit for you to get dizziness.
Okay. Dr. Kers, actually, processor or FM. Now, doc, also Ghana and people who do not trust our own people. They believe that our people are incompetent. They also have butcher. Even slippers company, or also $2,000 in Pabwa. What example, one I can say $1,000 because I got $2,000 in Papa. Let's look at the success rate of Dr. Kers. Ejuma, why?
Well, almost all my clients who take my advice are very satisfied. Who be so be our manage ejuma say I doing for since 2008. I've been doing this. You know, you shouldn't be afraid to come. You shouldn't be afraid to come. Now, most of the referrals I'm getting are it is a clientele base. Say my yam will be no so I can once much to know about. So normally I ask them, so how do you get to know me? We can so from social media, we can so my name will be a catch to me and you know, you shouldn't be worried, you should feel free and come. Even if you get complications, we are still able to solve it for you. Okay.
So the recovery is not up to 10,000 as 100,000.
It depends on the multiple procedures. If you so I want to do my tummy, I want to do my breasts, and on it will say at least it will go up a little.
So you want amount for ayebina amount for exercise on na we person defend there. Or say who needs kentin na wonko ye bi no. Doc, is it for the rich? Is it the expensive?
Well, only say in economics. You free say goods of ostentation. You know, and this part of surgical procedure is known to be on the higher side because Tisania now working a beer or the let's say a Louis Vuitton, for example. What in a BB baby seal now can say a 5 cities, 10 cities.
Because
I can say, Papa. You know, at the end, at the pan is a ton. So it has created a name for itself. And whoever is going knows that it is not something that is
cheap.
It's cheap, yes, let's put it that way. But at least, you show human face, kakra.
Okay. Okay. Because me such a kind me nearly be a interview or coin day or outside. Come such amount of money or say she spent over 60,000. That is like 4 years back.
Okay, but now it will more. This is exchange rate in Aquana cost. You won't get it like that again.
To be 200.
It depends.
In Ghana, here not like traveling.
And I make a sure say it depends. If you are doing just one procedure with me, it will not reach 100. But if you are doing multiple procedures, definitely Yeah.
Should people gather courage and come?
Of course. Oh, because maybe they say March, any early April. Every week I was doing 3 cases. Every week I was doing 3 cases. Or Monday, every Monday and Wednesday, they are me cases. But I mean, say as I cook down a crime, say economy, no. I'm also see inflation buffer, but.
So, and yet a walk-in thing now, you can just walk in.
Yes,
You have to book appointment. Also book appointment.
Oh, at least I do my clinic once a week.
Okay.
Because in Nippon you be brave, or crowded. Once a week. So we can even do it online. So I do my clinic once a week at airport. Sorry, East Legon.
Okay. Your place now?
Yes,
yeah,
my place. Yes, okay. Exactly. That's where what they say. Mediport Fertility Services. Yeah. Yes. So once a week, but a bit no more no more. Yeah, a jumenti or so that one you need to book appointment so that I can do a weekend consultation. Okay. It can be a Sunday or it can be a Saturday, but you must inform me in advance.
Okay. Doc, but your contacts in them? No social media handles.
Yes, social media handle Instagram dr_curves CURVES, and let me make sure the telephone number is the right one because it's someone who carry that number.
Okay. So I like calling him Dr. Curves because the last one, no.
I was charging a pa.
Timbo doctor come here brown but they catch you know. But I cheating.
Oh, cheating pa. Me a quabrini.
Oh wow.
Quabri.
I
broke yanchra.
If you're my cousin, I think it's a quabri.
Your cousin a quabri.
Yeah.
I don't move meeting here. So the other now one that go to my assistant 055 399 8989.
Okay.
055 399 8989.
Doctor, me that's a person will be in man.
Yes,
thank you very much for also watching. Doc, maybe this watch about enhancing your body. But enhance your body, no, make a phone at the back of F5.
Okay, and Yama yet in fact, Nyankrofoba Bibisa pa number 1 is liposuction.
Okay.
And then liposuction and BBL.
Okay. And a two.
And a two. Even so, arms, no, say arms, no, so you fat being free. So,
especially more almost what's in the say, I cry.
And I say, brachioplasty, and no, and some we have fat never bojo. Until we reduce the skin and a brachioplasty.
Okay.
Now, yaba tummy tuck.
Okay.
Tummy tuck, say no, Tiasia.
Yeah. But we won't Tiasia, no.
Oh, tummy tuck, no, Sebi or more. Na ofru aye kese na afi obi hu say afru bi atiegu sebe wo she pound kra na ebu aguso on say wa antwe amaso obi hu say wafu no akwakogu ayase eno no say skin na wo fu ma e de ba ayase ni na yi firi ho no na ama why flat kama so yaba breast breast ni o ma horo mi nsa ba ko ye breast no so so obesa otiso fa breast so so no enye ebi wa enye ahote a problem a man no
so
yes because onofo no so ebi wa brazier kro bokro onya right brazier ubo brazier so won say wa beti no because of wage nti e twa honom ebi timi ye kro
wow
yes and na ntoso so wo mo chitimi ye wo mo ya pa back ache means how to say wo nya rush wo mo nufu ase. The worst one is especially one more students no. When to any physical exercise via school, you can some go PT cry a challenge man. And you know, we do that one is breast reduction. And I feel so one man could no for man no for not tiegu and also breast lifts. Yes, sir. And you want enhancement. And I feel say they can need it as a cancer and enhance it down as a come on also. The money come on.
Okay. So doc ache baby the part of your body obetime enhance and nyina no me na dom o manim de no obetime abo. Medin Zionfelix as usual. Many Dr. Curves and edi nkomo because of recent conversations about a lot of people have it about the body enhancement with ladies because it's any day married and a lot of people keep criticizing it. And I'm also just saying, to say a man for the right education, no, say be a who they are put more decisions. Bye bye. And right here in China, I'm here preparations for us to go to China October, November, as I've been saying. So October, November, we're there. China and Zionfelix will be echo. Let's go to China this October, November. Price in the Gusuno, date in the Gusuno, contact details. We be a check going to show Fred. That John is Felix. Na yanko me see me do ko bia mo be come here or share there your way Felix organized trip and you travel and to be na me ya man mako China 2 solid times I say more China out me to my say be our China experience will be different. Call the numbers on the screen. Join Felix for us to go to China October November 2026.